Good evening, wherever you are. This is Kai Lennox from ConferenceHype. Our segment will focus on dapagliflozin and acute kidney injury following cardiac surgery, a randomized clinical trial. From the 2026 July 30 edition of JAMA. Background in patients undergoing elective cardiac surgery to evaluate whether initiating dapagliflozin 1 day prior to surgery reduces the incidence of AKI at 7 days after cardiac surgery, compared with placebo. Methods, design, setting, and participants. Multi-center, double-blind, placebo-controlled randomized clinical trial conducted at 2 academic medical centers and 5 non-academic hospitals in the Netherlands. Results of 784 participants enrolled, 778 completed follow-up testing, median age 68 years, 76% male, 97% white, median body mass index 27, and median estimated glomerular filtration rate 80 ml min 173 m2. Discussion, trial registration clinical trials, Gov identifier, NCT 05590-143. From the 2026 July 22 edition of JAMA. Gastroparesis is a condition of delayed gastric emptying in the absence of gastric outlet obstruction. Based on a 2018 U.S. Administrative Health Insurance Claims Database study, prevalence of definite gastroparesis was 21.5 per 100 persons. Observations: gastroparesis, which is caused by reduced contractions of the distal stomach or abnormal pyloric relaxation, is more common among females than males and typically causes nausea, vomiting, early satiety, bloating, and abdominal pain or discomfort. In a large U.S. epidemiological study involving 82.6 million patients, the most common causes of gastroparesis were type 2 diabetes, post-surgical effects, medication-induced, idiopathic, type 1 diabetes, and other. Other risk factors include neurological disorders, hypothyroidism, amyloidosis, connective tissue disorders, and viral infections. From the 2026 July 31 edition of JAMA. Background: to determine whether a regimen with doravirine, lamivudine, and tenofovir disoproxil fumarate results in less weight gain than a regimen with dolutegravir, emtricitabine, and tenofovir alafenamide, while maintaining non-inferior viral suppression. Methods, design, setting, and participants. Open-label non-inferiority randomized clinical trial including ART-naive adults with an HIV RNA level greater than 500 copies ml and no detectable baseline high-level doravirine resistance. Results: among 600 participants, 597 were Black African, 413 were assigned female at birth, and the median age was 34 years. Discussion, trial registration clinical trials. Gov identifier, NCT 059244338. From the 2026 July 29 edition of JAMA. Background: to estimate the global, regional, and national burden of ischemic heart disease and ischemic stroke attributable to elevated LDL-C from 1990 to 2023, and to quantify the contributions of population growth, aging, risk-deleted burden, and exposure changes to burden trends. Methods: relative risks were derived from meta-analyses of 38 randomized clinical trials. Results: in 2023, elevated LDL-C accounted for 3.6 million deaths and 90.7 million DALYs. Discussion: strengthened prevention, diagnosis, and treatment access strategies are essential to mitigate the health burden of LDL-C. from the 2026 July 23 edition of JAMA. Background: to evaluate the effectiveness of prenatal and postnatal text-delivered video-safe sleep interventions for special supplemental nutrition program for women, infants, and children participants. Methods, design, setting, and participants. Unblinded 4-group randomized clinical trial of pregnant mothers recruited May 2022 through December 2024 at WIC and federally qualified health centers in 18 states, with 2 stages of randomization to safe sleep or control interventions. Results: of 1,790 participants randomized, 1,383 completed the 60-plus day survey and were included in the analysis. Discussion, trial registration, clinical trials. Gov identifier, NCT 043875552. From the 2026 July 28 edition of JAMA. Background: to investigate whether prone positioning in infants with moderate to severe acute bronchiolitis and HFNC support reduces escalation to non-invasive or invasive ventilation. Methods, design, setting, and participants. Multi-center, randomized, open-label trial conducted in 15 pediatric intermediate or intensive care units in France. Results: among 451 infants randomized, 446 were included in the primary analysis. Discussion, trial registration, clinical trials. Gov identifier, NCT 039768895. From the 2026 July 30 edition of JAMA. Background: cigarette smoking, maintained predominantly by nicotine dependence, is a long-term and relapsing behavior that continues to be a leading cause of preventable death and disease worldwide. Methods: e-cigarettes with nicotine are less harmful than cigarettes and have been shown to be more effective for smoking cessation than U.S. Food and Drug Administration-approved nicotine replacement therapies. Results: however, misperceptions of the harms of e-cigarettes are common, even among clinicians. Discussion: these recommendations are intended to provide evidence-informed guidance to clinicians regarding use of e-cigarettes for smoking cessation. From the 2026 July 20 edition of JAMA. Background: to assess the population health impact of the 2026 Guideline on Primary Prevention Statin Therapy. Methods: data were analyzed from March to May 2026. Results: the weighted sample included 4,366 NHANES participants representative of 154.5 million U.S. adults. Discussion, conclusions, and relevance. The 2026 Dyslipidemia Guideline substantially expands the U.S. population recommended for primary prevention statin therapy, predominantly in lower-risk individuals. ConferenceHype is interactive AI commentary only. It is not reporting, journalism, medical education, clinical guidance, scientific validation, legal advice, or financial advice. ConferenceHype is independent and is not affiliated with conference organizers, presenters, sponsors, or exhibitors. From the 2026 July 28 edition of JAMA. Background: to develop and validate the protein-based integrative analysis of lung cancer risk and etiology risk model in individuals with a smoking history from the general population. Methods, design, setting, and participants. cohorts in the Lung Cancer Cohort Consortium recruited research participants in the US, Europe, Asia, and Australia between 1985 and 2009, who were followed up for lung cancer and other health outcomes until 2021. Results: a total of 3,695 participants were included, with 1,951 participants in the training set and 1,744 participants in the testing set. Discussion: this model has potential to improve selection of high-risk individuals who are most likely to benefit from lung cancer screening. From the 2026 July 28 edition of JAMA. Background: to provide final overall results of a trial assessing whether adding ivonescimab, a bispecific antibody targeting programmed cell death protein 1 and vascular endothelial growth factor, to chemotherapy improves overall survival in this population. Methods, design, setting, and participants. Randomized, double-blind, placebo-controlled Phase 3 trial conducted at 55 sites in China. Results: the 322 enrolled patients had a median age of 59.4 years, and 51.6% were female. Discussion: trial registration, clinical trials. Gov identifier, NCT05184712. From the 2026 July 22 edition of JAMA. Background: to evaluate the benefit of thrombectomy, in addition to medical treatment over medical treatment alone, in patients with an AIS related to a primary and isolated MDVO. Methods, design, setting, and participants. Randomized clinical trial conducted at 22 stroke centers in France from November 2021 to April 2025, with planned enrollment of 488 patients. Results: of the 244 patients randomized, median age 75 years, 56% male. Median National Institutes of Health stroke scale score 8. 100 of the 123 patients in the thrombectomy group received thrombectomy, and none of the 121 patients in the control group received thrombectomy. 217 completed follow-up. Discussion: trial registration, clinical trials. Gov identifier, NCT05030142. From the 2026 July 27 edition of JAMA. Background: to evaluate the effect of an integrated intervention package on growth and neurodevelopment in term SGA infants. Methods, design, setting, and participants. Individually randomized clinical trial conducted in low-resource neighborhoods of South Delhi, India. Results: at 12 months, 1,261 infants had completed follow-up. Discussion: trial registration, clinical trials registry India identifier, CTRI 2021 110378881. That's it for now for ConferenceHype's coverage of the July 2026 issue of JAMA. If anything was missed, tell us which article deserves follow-up. Tag us on X. Add your perspective in the comments. Share this review with your clinical team, like the video, and subscribe with notifications turned on for the next journal broadcast.